everyone, and welcome back to another episode of Inside Dentistry, where we dive into real journeys of foreign trained dentists who are making their mark in the US dental world. I'm your host, Dr. Aster Vass, and I'm so excited to have you here today. This session is especially meaningful for anyone considering pediatric dentistry or applying to a US residency program. Joining us today is Dr. Anuja, a foreign trained dentist from India who is currently pursuing her specialty training in pediatric dentistry at Loma Linda University. She has such an inspiring story to tell us, and she is here with us today to share it. Dr. Anuja, thank you for being here with us. Let's start from the beginning. Can you briefly introduce yourself and walk us through your journey from dental school in India to joining pediatric dentistry program at Loma Linda?
Hello, Dr. Esther. Thank you so much for inviting me. And it's been a great platform to share my views, like my journey. From India, after my dental school, I've done both my BDS in Krishnadevaraya Dental College in Bangalore and MDS in Pediatric Dentistry from Narayana Dental College in Nellore. And then I came to the US last year and I have applied for the programs and I got in Loma Linda University of Pediatric Dentistry. So during this journey, the major steps when we see the broad spectrum, uh, after my dental college, after my MDS program, I've gave my INBD,
Yeah.
TOEFL, and GRE,
Okay.
and started the application process. Then got selected at Loma Linda University. Started my journey. But in this application process, like this very small steps when we
Sure.
see, yeah,
And
all
we
of
will,
them are important.
yes, and we will go ahead with all the steps that you took in detail. To start with, like what inspired you to take up pediatric dentistry for residency?
So since my childhood, like one thing that gives me immense joy is kids.
Okay.
So I believe that treating kids gives me even more happiness. And since childhood, I believe that changing young minds at earlier stages and taking care of their oral health brings a lot of change in the community.
Yeah.
During my BDS, I have seen a lot of adult patients whose oral health was not up to the mark, and major reasons for that was being traumatic, dental experience during the childhood. All those have in their mind, like when they grow, and I believe that the community to have a better oral health, the young minds make a major difference.
Yeah. So that is really nice and really thoughtful of you to like take that as your inspiration and go ahead into this specialty. So a lot of our viewers are curious about what happens between finishing BDS and starting a residency here. So what is certain steps that you took when you were transitioning and coming into US? You mentioned about certain exams you took. So could you just brief us a little bit about what are the mandatory steps that you should take before applying for the programs?
Yes. Well, when we see the major broad spectrum of the application process, it's the INBD exam, TOEFL, again, few requirements for the universities, and then
Okay.
application process. But before the INBD exam, we need to get the dent pin,
Yeah.
uh, identification number for the dentist in the United States, and we have to get our Indian marks evaluated according to the US standards, that is nothing but ECE evaluation. Later, we'll book the date for the INBD exam, and once we're done with the INBD exam or before, the TOEFL is one of the mandatory steps
Yeah.
before doing application process. And then few universities might ask you to take up GRE test depending upon the program again.
Okay.
And I had to give GRE exam. And then the application process itself, like it has four major divisions: the personal information, educational background, experiences, the achievements, submitting all of them, making sure that we have all of them before the start date of the application process is really important.
Yeah.
So for me, getting the letter of recommendations from India, from the professors, and writing my statement of purpose. Again, it took some time. All of these steps made a major role. Along with this, my clinical experience, research experience, volunteering experience, all of this made a huge difference, I feel.
Okay. And I do have some subcategorical questions based on what you just said. So, do most of the universities need EC, or do some universities also want WES evaluation?
Yes, most of the universities they accept ECE. There are few universities, like again Loma Linda.
Okay.
Loma Linda wanted WES evaluation,
Okay.
so few universities might even ask for WES evaluation. It's better to have both done
Okay.
before. Yeah.
Okay, that's good to know. And what are the ideal TOEFL requirements for this kind of programs? The scores and everything.
Yes. Well, for most of the dental programs, be it for DDS, DMD, or for the residency programs, it's better to have a TOEFL score of 100 or above.
Okay.
So it's recommended. It's not like if we are getting 95, there's no way to get into the school. It's nothing like that, but it's always recommended to have 100 or above. Few universities are strict about it, and few universities, they don't mind from 90 to 100 also.
Okay. And are they very keen on certain sections of the TOEFL that needs to be way above in score?
Nothing as such.
Okay.
They're all equally important, all the sections.
Okay. And you did mention GRE based on certain programs you might have to give or not. And coming to LORs, right? So, like, how did you go about your LORs? Like, what kind of recommenders did you approach to? And another question to that is also like, did you go ahead with your BDS dean or your MDS dean for LOR?
So for the letter of recommendations, for the pass applications is it's quite different from the
Okay.
capit application. So for the pass application, it's mostly like the filling the blanks. When we submit the name of the professor
Okay.
and when we submit the email of the professor, the pass application, the ADA pass itself sends an email to the professor
Okay.
asking for the letter of recommendation to this particular person, to the applicant.
Okay.
So, in that way, I approached the dean of my MDS college and the head of the department of my pediatric dentistry in MDS. Since I'm applying for the pediatric dental residency program,
Yeah.
I believe that it's important to have somebody who is good in, like, who has made a major contribution to the field in the pediatric dentistry in both clinical and research.
Okay. And what about the some of them who have done their masters in the US? Maybe not clinical dentistry related, but non-dental related. So, like, do you advise them to get an LOA from those professors of that side of the field too?
Non-dentistry,
Yeah.
I- uh, I believe it's better to have LOS from the professors who has done their who are in the dentistry field
Okay.
rather than other masters.
Okay. That is really insightful so far. And so tell us about your experience so far in Loma Linda University. You are in your first year residency, I believe.
I'm the about to get into this school. Like I got
Okay.
in, I have to start my program from
Oh,
June
wow.
23rd. Yeah,
Okay. Okay,
I'm
that's
still in
nice.
Seattle. I have to
Okay.
move to LA next month.
Okay, that's really nice. I didn't know that. I thought you'd already started your program, but that's really good to know, and that must be really exciting. So you're
Yes.
yet to meet your class and find out. So what's the class cohort looking like for you?
So we are a class of four
Okay.
members for the 2027. So two of us from India and
Okay.
one is from US and other girl is from I don't remember the country, but not US.
Okay. Oh, that's nice. So you have a good, classmates from the outside of US too. And do all of them need to have a master's back home from their home country, or do the program like do they welcome students who have just done DDS or BDS too?
Yes, that's a really good question. So there's so many assumptions like to apply to the residency
Yeah.
program, they think that it's mandatory to have the masters from their home country, but that's not true. We can apply directly with bachelor's degree in dentistry from India or any countries, or
Okay.
even just DDS from the US.
Okay. And what about AGD program? Do you think that's a good way of approaching and getting into a residency program as well?
Yes, of course. There are a few universities who has the requirement having 1 year of AGD program in the
Okay.
United States. So that broadens your options to apply to the universities. AGD program, or you can directly work with the AGD program. 1 year AGD
Okay.
program, you can work in one state, that's Virginia. But
Okay.
when we have 2 years of AGD program, we'll have a broader, states to work. There are up to 12 states where we can work.
Okay. That is really insightful as well. And so there's always a debate about do you need a research heavy CV for pediatric programs or other residency programs? So do you think that that really plays an important role during your application?
Well, coming to the research, it plays a major
Okay.
role in the field of dentistry. Nowadays, we're in the era where dentists follow evidence-based dentistry.
Yeah.
So, any clinical work without research, doesn't make sense. It's
Yeah.
important to have the research along with the clinical experience. So,
Okay.
to apply to the programs, I would definitely say research makes a lot of difference. Yeah.
Okay. And like most specifically dental oriented and not non-dental oriented researches, right? Or in general, like any kind of research is also useful.
Dental related, especially if we are applying to a particular program,
Yeah.
particular specialization, it's better to have some research in that particular specialization
Okay.
before applying to the program.
Okay. So we did put up a question poll on our Instagram for certain questions if anyone had based on this session we're having today. And most of the similar questions we had was about the application process. So let's break down the application process a bit. When should someone ideally begin preparing for the residency application?
So, coming to the timeline for the application process, it's always better to begin with the end in the mind,
Yeah.
which means saying that I would say we need to have a goal when to get into the school.
Okay.
Let's say I want to get into the school in 2027. For that, I have to start application process in 2026. For the residency program, it's May. The application process every year starts in the month of May.
Okay.
So it's good that we're talking right now because
Yeah.
2 years ago the ADA pass application process opened. It was May
Sure.
6th, May 14th, sorry. Yeah. So
So,
every
yeah.
second week of May, the application process begins, and by the month of September, October, November, we'll be getting invitations from the universities for the
Okay.
interview. And once we're done with the interviews, by the end of January, we'll be having the match results. So
Okay.
pass application will go through something called match process,
Mm-hmm.
and will get matched to the program that we have applied and we have interviewed.
Okay. Can you explain us a little bit about what is pass and match? Because for a lot of us are not able to understand the difference between the two. And is it okay to just apply in pass, or do you have to apply with both of them, or something like that?
So the whole pass application goes through the match process. So
Okay.
when we are doing the pass application itself, there's a column asking for our match ID. So we'll be creating a pass match ID and providing it in the pass application. So it's a process where once the universities invite us for the interviews, will be listed in the match. So the
Okay.
director of the specific program, when they interview us, let's say they interview three people, they give three ranks for the three of them, like one, two, three.
Okay.
Again, the applicants, the students who interviewed at that particular university, they start giving ranking to the university. So
Okay.
what match program does is it'll match the rankings of both the university and the student. And that's how the student and the university get matched.
Okay, that's very interesting. So are you saying that you are able to like rank those schools only after your call for an interview?
Yes, we can even
Okay.
rank without interviews, but it doesn't make sense. Like the university anyway is not going to give a rank to you
Okay,
because you are
yeah.
not interviewed.
Okay, so it happens after and only when you're invited for an interview, and then that's the way to go about it. Okay.
Yes, yes.
Okay. And so what after an interview? Like, how's the interview process like? Do you have any other subcategories of evaluation once you are invited from the school?
So once, unlike for the CAPID applications, most for the residency programs, they don't call us for the bench test.
Okay.
Most of the residency program don't ask for the bench test, but there are few residency programs that would ask for the bench test as well. For the pediatric residency program, especially, I interviewed at three universities, and
Okay.
none of the university asked for the bench test.
Okay.
So it was direct interview, 1 day interview, and then the results.
Okay. And how is the interview like for you? Is it one-on-one? Like, there are so many ways these days, like MMIs, Kira. And so is it something like that for interviews or for residency programs?
Yes, few years back, it was only online interview, and
Okay.
now it's in-person interview. So there's a full panel interview for University of Maryland. I was interviewed there. It was a panel interview there. So six professors were just sitting in front of me. That was a little intimidating, but yeah, the interview went for 30 minutes.
Okay.
And for Loma Linda, it was two panel interviews. Like there
Okay.
were three rooms with two professors in each.
Okay.
And again, at University of Rutgers, it was a panel interview with just two professors in the
Okay.
interview hall. Yeah.
Okay. And what's like the interview questions? Is it very personal, more personal based focused, or are they also like kind of asking questions regarding radiographs or anything like that?
One major thing is most of the universities would ask behavioral questions.
Okay.
For them, our personal experiences and all makes it's very important for them. Along with that, a few universities, since it's a for the residency program, they might ask questions about the research, our clinical experience, and all of that. For me personally, at University of Rutgers, they asked questions showing up the X-rays. They
Okay.
asked the treatment,
Planning.
treatment planning
Yeah.
and diagnosis, everything. And yeah, research-based questions is one thing we should be, you know, prepared for.
Okay. Okay. And I know this one is a little tricky question, but any tips for those preparing or writing a strong personal statement or resume?
Is so SOP doesn't like we can't just sit for 1 day and write the whole SOP. It doesn't work that way. According to me, I feel you should give it some time. Every day we should put our inputs into the SOP, and by the end of few days, we'll have some content. With
Mhm.
that gathering of the whole content, we can write the SOP. So the strong SOP is making it personal. So
Yeah.
we have to personalize the SOP, and it's better to write it that way than just giving it to the chat GPT.
True. And is it just one SOP for all the programs when you're applying for through PASS?
So yes, when we are applying to one specific program, one specific specialization, it's better to write the SOP according to that instead of writing for various different specializations.
Okay.
There's just one SOP submission in the past.
Okay, so it's not advised for somebody to apply for different specialties in one application, is what you're saying, because it's one SOP at a time?
Yes, I suggest to apply for one specialization because
Okay.
SOP speaks a lot about ourselves, And when we write about two or three different specialties in single SOP, it dilutes our SOP. It's better to
Yeah.
keep it one specialization. Also, when we are applying to the universities, it's better to apply one specialization in one particular university. Like, do not try to apply for both the prosthodontics and endodontics in the same university, because they go through the professors get to know that we have applied for the both the programs, and it shows that there's no interest for one specific program.
Yeah. And what kind of clinical experience do they look for? Like for some people, if they're just graduated, do they look for a lot of work experience back home, or do they also welcome people who have experience in the US, as such as dental assisting or something related to that?
Is having clinical experience in US is really important, because having exposure to the US standards of dentistry
Yeah.
and getting exposure to the dental materials here, like, we might not have the same dental experience back in home country. The latest advanced dental materials, like monochrome composites and all, what they use here, it's better to have dental experience in US before we are applying to the program. Let it be volunteering at a dental office, or shadowing at the dental office, or having volunteering work at the community centers, or doing a preceptorships or externships in the university.
Yeah.
Everything, all the volunteering works is going to help. In any way, having exposure to the US dentistry is really going to help.
Okay. And I think that was a very brief discussion about the application timeline and the process. The next thing we will talk about now would be like the licensure after master's, right? So now, once someone has completed their master's in pediatric dentistry in the US, so what are the licensure options available to them?
So one thing everyone thinks is, after residency program, we are just restricted to few states, but that's not true. Like, we can work in all the states, but working in private offices is just restricted to some few states.
Okay.
But in the other states, we can still work in the federal or in the dental schools. So, let's say after doing my residency program in the pediatric dentistry, I just want to apply for the professor, like faculty position in a dental school. I
Okay.
can directly apply in any of the
States.
universities in any
Okay.
state.
Okay.
Or if I want to work for the federal in the US, I can apply for the any state, and will be getting the work visa from the federal.
Okay.
But to apply for the private practices, there are 12 states in the United States after the residency program that accepts foreign trained dentists after the residency program.
Okay.
There are Washington, Oregon, Nevada,
Okay.
Texas, Michigan, Mississippi, Minnesota, and Connecticut, yeah,
Okay.
Virginia.
Okay. And you're saying that these states will open up right after you graduate from a master's program. Like immediately all these states are accessible to you.
So I would say we have to apply to the each state. It's
Okay.
not like once we graduate, we are just eligible for the dental, like, we can just get the dental license directly from the state. It doesn't work that way. So once I graduate, I have to approach the state dental board asking for the dental license in that particular state, and then we'll get the dental license. So
Okay.
it's not easy to hold all the states dental license, so
Yeah.
we have to be paying for the state particular dental license annually.
Okay.
Yeah, we have.
And so I did hear that some states open up for you after you have like 3 to 5 years of work experience after graduating, or some things like that. So can you? I'm hoping you know about it and you can explain a bit more about that for us.
Well, there are few states like California again.
Okay.
They'll open after 2 to 3 years of dental experience, like in other states. My husband, he has done AEGD from University of Maryland, and
Okay.
he's been working as a general dentist in Washington State since 2 years. And now he's eligible to apply for the California state of dentistry. He can get the
Okay.
California dental license after the 2 years of work experience in the other state. It
Okay.
works like that. Like for the California, yes, we can do it.
Okay, and that's a good personal example as well for our viewers. And what about getting a license for the general dentistry along with the residency license? Does that work as well?
Dental license for general dentistry.
Yeah, yeah.
Yes, once we're done with the specialization, we're eligible to do the general dentistry, treatments as well.
Okay.
Yes. So
Do you need to like have a separate license for practicing general dent, like, as an edge, others you just have to, I don't know, like, do some states need both these licenses, or do they are okay with you just having a specialty license?
as far as I know, it's okay to have just the specialization license
Okay.
to to do the general dentistry procedures as well.
Okay, that's good to know because a lot of our poll questions were confused about that, whether they will be able to do both of them or are they just inclined to just do one. I think we did cover a lot of things in terms of licensure and the process of application. Do you have any more insights to tell us about your journey or certain challenges that you faced while you were applying to this program?
So the challenges that I faced during the application process was, listing out the universities which accept the foreign trained dentist, also provides the visa to the
Yeah.
foreign trained dentist. So we it's very important to go through the pass application, to go through the program finder of each program and check the list of the information that the pre-requirements that they needed for the program. So each program has different requirements. It's very important to check each program before we are applying to the programs, and it's very important to check whether they are sponsoring the visa or not. Few universities, they might just accept the foreign trained dentist, but they might not sponsor the visa. It's
Okay.
important to check both if they're providing visa as well, if that's a requirement. So that was a bit challenging, like to know about each university and approaching the universities, talking to the directors and everything.
Okay. And would you advise people to go and have a class tour or like a campus tour of certain universities that they are leaning towards applying?
It's always better to have personal touch with the program directors, with the professors, and even the students. It's always good to go to the like visit university in person and talk to the people, make connections, and that's going to help a lot. The program directors incline towards people who they know personally rather than someone coming new.
Okay. Okay, that's a very valuable advice. And so, finally, looking back, if you could go back in time, is there anything you would have done differently?
So one thing I would have done differently is planning ahead. Uh, I could have applied to the programs back in 2023 itself to get into the program in 2024. So that's one thing I would suggest to the new aspirants, like plan ahead. The application process, INPD exam, you can just visit to USA, give the exam, and go back, continue with your program back in India, and give the TOEFL exam back in India itself, and have the all pre-requirements ready before you're coming to the USA itself. That's going to
Yeah.
help to get into the school early.
And what about ADAT exam as well? Because I didn't think that we came across that. And can you give GRE in the US, or no, sorry, you have to give it back in your home country, or you can give it here?
We can give the GRE in both home country or in the USA. I
Okay.
personally gave my GRE in USA.
Okay.
Yeah.
And coming to the ADAT question, do you need to give ADAT for residency programs?
So there are very few universities and very few programs that would ask for the ADAT. I personally didn't have to give ADAT for any of the universities that I had I was applying.
Okay. All right. Dr. Anuja, thank you so much for your time and honestly, your wisdom today as well. Your story has definitely inspired a lot of aspiring dentists out there. And I think we have come to the end of the session and we have answered a lot of myths that you've busted too for us. And to all our viewers, thank you for tuning in for Inside Dentistry. And if you're not already, follow us on Instagram and YouTube at Dental Student Society.
Thank you so much, Dr. Esther, and thank you so much for having me. And whatever you're doing now, it's a very great thing. Helping
Thank
other
you.
aspirants who are interested in the US dentistry, it's really a good thing. Thank you
I'm
so much
happy
for
to do
doing it
that.
for the other aspirants.
Thank you so much.